So I just wanted to introduce Leslie. Leslie is a focusing oriented therapist, as am I. We both trained with Jean Genlin in working with the felt sense in the body. And Leslie also helped me edit my book. Don't know what I would have done without her, honestly. Leslie's an incredibly smart and gentle and very, very skilled therapist. We've done lots of co-teaching together in her beautiful work with dreams. And lo and behold, she took this work and our collaboration and actually integrated it into the Felt Sense Polyvagal model with the work that she's doing around nightmares, which was very cool to see. So, and I'm really excited to hear today exactly how you did that. She also has written a paper about it, which Steve Porges has read and really loved. He said he was inspired, which is a real compliment to Leslie. So without further ado, here you are, my friend.
Thank you for that sweet introduction. And so to start with, because this is an embodied practice that we're talking about, and I wanted to start by the tradition of this group is to start with some kind of an attunement, or just an acknowledgement that we're in our bodies and we want to help our bodies settle so that we're fully present, not just in our mind but also physically present. So just to start, while everybody's still settling in and arriving, just to get yourself really comfortable in your chair and feel where the support is coming from underneath you. So feel it, how the ground supports you and your chair supports you. And what I like to do to really find it is to find exactly where my center is. So just to shift around a little till you feel like you're really centered. And then bring your attention inside. So just ignore all of the little boxes and people in front of you for a minute, and just check in with your own body and your internal sense of your body. And just that much, just notice how you are in there and take a breath or two if that really helps you settle and feel more present. And so when you are about to hear a presentation and I invite you to ask questions, I want you to try and listen from this internal space as well. And any questions that arise, they can come from inside as well as your curiosity from both your mind and your body. All questions will be welcome. And I have created a little PowerPoint which covers a vast amount of information. So I'm not going to be able to really say everything I would want to say about this topic, but I'm hoping to give you an overview of my very current thoughts about it and ideas and what I've done with it. And then I'd just love to hear your responses, questions, interests. And so I'm going to share my screen. And I think it's probably going to show the whole screen. I might have to just hone in on the slides, because what I did was when I pressed the slide presentation, it filled my entire screen and I can't see you. So I didn't want that. So I'm going to fiddle with it for a second here and get just a portion of the screen that I want. And okay, and it should, does that show you the?
Yep.
Yeah, okay. It doesn't seem to be the perfect size box, but it doesn't let me change it. So that's, hang on, let me try something else. Let's just shrink this a little. All right, that's pretty good. You can see the nightmares and the nervous system. Yeah, I can still see you. That's good, because what I really don't like, especially when we're in Zoom, is to present to the, to the screen as if I'm the only one in the room. It starts to get a little disorienting for my body. So I'm really glad I can still see a lot of your faces. So now I'm just gonna go to, I'm gonna give you just an overview of what this presentation is about. And what I'm really coming to, and I've been working with dreams and nightmares for over 20 years, but more recently, I would say in the last 7 or 8 years, I've been really interested in nightmares and treating nightmares and using embodied processes, because that's how I work. And so I did my doctoral dissertation on treating nightmares using focusing, which got me sort of very interested in the topic, but it was only a start, I would say. I think there's just so much more information. Dreams are really inherently difficult to study because they happen when we're asleep, and you can't ask somebody what they're dreaming. You can only wake them up later and ask them what was going on, and they won't have a perfect memory. So it's really challenging to try and understand dreams and the body, but we've gotten so much better at measuring and measuring the brain and the body, and the tools and the technology have made us a lot more aware of what's going on when we're sleeping and dreaming. And what I've come to believe is that the dreams actually come up through our bodies, and that the dreams are images of our nervous system, of the state of our emotional body and our nervous system. And they're dynamic. I know Jan talks a lot about state shifts in her work with addiction and trauma, and our sleeping is just a series of state shifts. And what the researchers have found is that when you shift from sort of non-REM, other states of sleep, to REM sleep, where most of our interesting dreams happen, there's a shift in our nervous system. It goes from parasympathetic to sympathetic. And in that time, if you have a charge in your system, then your dreams are going to be nightmares. And that this is starting to really, there's starting to be emerging evidence, physiological evidence that this is true. And so I'm going to talk briefly about that, and it's emerging. So the information isn't deeply studied. It's kind of a fringe area, but I'll talk a little bit very briefly about the polyvagal theory and how it's changed the way trauma is treated, because Jan has really covered that part beautifully. But what I found was that polyvagal theory has really made us as trauma therapists aware of how important it is to understand the body's responses to threat and the hierarchical nature of these, and to really see it as adaptive, a means of survival, and something that might become problematic if it gets sort of locked into a pattern that repeats even when we are no longer under threat. But this has really revolutionized trauma treatment, and it hasn't changed the way nightmares are understood or treated. And so I've spent a good couple of years actually working on a paper to try and bring the polyvagal theory into an understanding of nightmares and their treatment. And so this is what I'm going to give you a little taste of. The paper is like 65 pages, so I won't get to cover it all. But I really found a lot of evidence to support it. So I'll give you a little taste of that, and then we'll talk about how I've incorporated these ideas into ways of treating nightmares, and the importance of safety first. Porges idea that safety is the treatment. And so I'm going to skip over the polyvagal stuff, because I think that is going to be fairly well understood by this group, and go straight to this particular slide, which is one piece of evidence that supports this idea that our bodies are actually implicated in our dreaming process. And this is a very recent study by a group from the University of Pisa in Italy, and they've found basically a brain-body network that basically is implicated in the generation of dreams. And so we know that dreams coincide with activation. We can see that when we see how the brainwave patterns will indicate when you're dreaming, and you can monitor people's heart rate and blood pressure, which are indications of autonomic activation. But it's a sort of a chicken and egg question. And this particular group found a causal link between body state and conscious dreaming experience. So that a sense that the dreams are coming from our bodies, and that the content is reflected in our dreams from the bottom up. And also, once we have these dreams, especially if their nightmares are really intense dreams, then the material in the dream will in turn affect our body. So there is a bi-directional link, absolutely, which is a good thing, because it means that we can also impact our dreams and help and shift our physiological state by the things we do. But this was, really I think it shows that our dreams are a picture of the shifting state of our autonomic nervous system, and that dreaming is implicated in the regulation of our nervous system. And so it really supports my idea. Another thing that I find interesting that I haven't really found anybody have talked about anywhere else is the link between nightmare content and the autonomic nervous system and the hierarchical threat responses that Porges has identified. And so there's many studies that look at frequent nightmare themes and topics, but I picked one that really had like maybe 1,200 people that surveyed their content of their nightmares. And what you can see that failure or helplessness, physical aggression, accidents, being chased, illness or death, and interpersonal conflict were far and away the most common nightmare themes. And all but accidents, you can see, have a direct correlation to one of the main threat responses: immobility or fight or flight. Accidents, could be, I'm sure, implicated in a way as well into the nervous system. But this is almost a perfect mapping. And so I feel like that when our dreams are depicting us being chased, or when we're in that state where we just feel helpless and can't move, that those are an image of what our nervous system is doing in that moment. And I also think it's not just to make us miserable that these states come about, but that our system is actually trying to regulate. So it's bringing this content in so that we can imagine it or have an experience that's different. And what I do with the dream work treatment, and a lot of the nightmare treatments do this, is find some way to empower you as a dreamer to change the content, to develop some idea about where to go next, in particular with nightmares that repeat and repeat because they get stuck in a loop. And I'll describe this more later when I pull up a diagram. But that there's a way that the dreams, I think, are trying to help us work out the trauma. And there's lots of evidence about this, that dreaming and nightmares are really a way of working through and regulating the trauma. And over time, they are successful, except in cases of, post-traumatic stress injuries. Sometimes they get locked in repeat, or they'll come back up when a person's system is really stressed. And so they don't always take care of themselves, and sometimes they need our intervention. So who has nightmares? This is a really important question. And also, I think it supports my idea about dreaming and the nervous system. And researchers have found that nightmares need two conditions: a trait and a trigger. And they would identify really highly sensitive people, or people with what they call thin boundaries, or a highly activated stress response. So sort of naturally sensitive people as more likely to have nightmares. But I have a question about that, because I wonder if these are truly inborn traits or signs that their autonomic nervous system has already been sensitized to threat by very early adversity, because there's a strong link between early adversity and nightmares. And the reason it hasn't been categorized as trauma, sometimes these highly sensitive people who are prone to nightmares, is because I think the definition of trauma has really historically been a little bit too narrow, a lot too narrow. And so early adversity can be something like, they found that people who were first born are more prone to nightmares because their nervous system is more sensitized. And I think every firstborn probably experiences a deep sense of abandonment at the point that their sibling arrives and they are no longer the center of the universe, especially if they're very young. That would be a major trauma, even though it's not characterized as one. It's just a normal everyday experience. And the same with maternal separation. If for any reason your main caregiver, which is usually your mother, has to leave for illness, for any number of reasons that may not be abandonment per se, or a kind of trauma in the family, can affect a very young one so deeply that they would have lost a sense of safety in the world that could lead to this a sensitized nervous system. And my point is that it really, I think it can be true that this trait is actually not a trait, but more of a response from the environment, so that someone's nervous system is sensitized by trauma, and that possibly all nightmares are related to trauma and adversity. And the other thing we know about nightmares is that they are very highly correlated with a lot of different forms of mental injury, psychological injury. Post-traumatic stress injury for sure is the nightmares are a cardinal feature of this. Over 90% in some studies show that people with PTSI, I like to call it, are suffer from nightmares. It's also linked with anxiety, depression, all forms of mental illness. It's also one of the things I like to stress, because I really think it's important to treat nightmares, because they are robustly linked to a higher risk of suicide. The more nightmares somebody has, the more likely they are to attempt suicide and repeat attempt, because the frequent nightmares give them the sense of hopelessness. And so it's really important to treat nightmares because of this. Okay, so now we're on to this. You'll probably recognize if you've been in some of these groups before. This is Jan's Felt Sense Polyvagal model, which I've adapted to nightmares. And I know the print is really small, but the idea here, on some basic ideas that I want to just point out, is that the top half of this diagram is where nightmares occur, and they can be in this parasympathetic end, which is more commonly understood with nightmares, where there's a fight-flight response and lots of activation, and people will wake up from their dreams very frightened and with their heart pounding and sweating and all of their, there's a big activation that can happen with nightmares. And enough, I think it's all that activity that tends to wake people up from their nightmares. And then there's also this immobility response. And I think this is characterized by dreams that are really where a person feels frozen or dissociated or has a hard time waking up. And what can happen is that a person can get stuck in this cycle where this activation is so great, they cycle into an immobility response and then feel like need an activation to get out of it. But they cycle around in this upper loop and never really drop down into a sense of safety. And so their dreams keep repeating. And this is where I think there needs to be some kind of intervention to break this cycle, which can loop around and around. And really, some people can suffer for decades with these dreams. And I also want to point out that we don't just dream, from this upper portion of the diagram, but we also have dreams of play and safety and intimacy. And so I think that the polyvagal model can actually apply to all dreams, not just nightmares. It's just that nightmares are what we are focusing on today. So just to kind of overview or conclude, what I would say are the main takeaways from all of that is that nightmares are a symptom and an attempted solution for adversity and a sense of distress or a feeling of not being safe. That nightmares are an indication of a nervous system that doesn't feel safe. And they reflect a history of trauma and adversity, even if it's not known or conscious. And they occur in the state shift between non-REM and REM sleep. And they can be seen as the body's attempt to regulate. I don't think of nightmares as so much as problems, but they can become so if they really interrupt sleep. They become a problem in themselves when people are afraid to sleep, and so when we're overwhelmed, as I'm saying, the nervous system can be locked in this cycle of activation and immobility that can be reflected in the dream. So I've made this a mission of mine because I really feel like, because there are such well-developed evidence-based nightmare treatments, and that they when they work, which is, maybe not all the time, but maybe, roughly 2/3 of the time, they can make a dramatic difference, and they can do so very quickly. So I feel like this is something that, especially if you work with trauma or addiction, that there's a good reason to ask about nightmares and this particular form of working with dreams, even if you don't work with them in any other way, is something that you should. I would love it if you would consider it. So I'm just going to give you a brief sense of how to treat nightmares, and so you have something to take away with you, even if you don't pursue this any further, is that dreams, they'll depict the full range of the autonomic nervous system, as I said, and nightmare therapy is typically a rescripting process. So the process of taking a dream and imagining a new ending, or imagining it differently, or what if this happened, and most nightmare treatments, including the most well-researched, which is called imagery rehearsal therapy, basically ask the dreamer to simply take the dream from where it ends or where you want to change it, and imagine something different. And you can revisit that, you can journal it, you can reinforce it, but really it's as simple as that. So I've developed a protocol that I call nightmare relief, which incorporates some of the ideas from polyvagal theory to make this process, I feel like, more safe and effective, because there's for reasons not well understood, this nightmare therapy works so well for a lot of people, and then for some it just doesn't. And I think it has to do with the different nervous system responses, and that if a person is in this immobility response, it takes a lot more doing to connect with them and establish a sense of safety. So the process might need to include beginning with resourcing and establishing a sense of safety, like any good trauma treatment would, and then to bring in this sense of safety, to teach someone or seed the idea that they can bring this in while they're dreaming the dream onward. And what happens is that for most people that I've worked with, is that the content shifts to something I call home, not meaning a physical place, but home being a sense of being safe and with other people. And that seems to be kind of a universal pull towards safety. And it makes perfect sense in light of the polyvagal theory that we would feel safest with others. And so the dreams kind of want us to move in that direction. And the future dreams reflect this shift. So the dream content, when we imagine a new dream and it includes safety and we spend time there, it seems like it infiltrates the dreams. And so the nightmares, I will say this is, true, that not a single person that I worked with their nightmare has had the same dream again after that. And some of their nightmares have changed in subtle ways and brought in little threads of safety that start to work on their dream life and shift it. And some have stopped having their nightmares altogether. And so it's interesting and powerful, this intervention. And so here's the actual steps. That's sort of a general kind of overview. And here's what I do in a very brief point form is I instill hope and positive expectation about the treatment. This is not really a step, but this is just kind of a preparing, because a lot of times what happens when people have repeated nightmares is that they've lost a sense of hope, and that's what links it to suicide so much. And so and they're more likely to engage with the therapy process and more likely to have success with it if they feel like it's going to work for them. So I just say things like I've just said, like I've never had this not help in some way or another. And you can point to the evidence, which is that the nightmare treatments are really effective. Then I do some calming and clearing so that they find a sense of presence and safety in their bodies. This may be easy for some and not so easy for others. So all of these points I would elaborate on greatly if I had time. But then I would bring back the dream. And there are many considerations about how much to go into the dream, whether you want to bring someone right into the traumatic event it depicts, or whether you want to stay more distant from it. It really depends on your way of working and the how resourced the person is you're working with, and where you are in your therapy, and lots of things like that. But you need to manage the activation or the overwhelm that could happen to stay in the therapeutic window. And so that is a part of the toolkit of really, I think, anybody who works with trauma. Then I ask the dreamer to find and embody something helpful in the dream. Something that brings strength or resource. And surprisingly, even in really, really frightening dreams, there's pieces of help. And I feel like they're more powerful and effective if they come directly from the dream that the person is working with. And it seems, and Jenlin said every dream contains this. And I'm not sure every dream contains this, because sometimes dreams are just downright terrifying. But if there is something in there that does help, I ask them to find it and bring it with them, because it's likely that if they have the dream again or something similar, that help will be there too. It will be available to them in the night. And if there isn't something like that, then I invite them just to find that calm, clear space in their body again before they dream the dream onward, because what happens in our imagination is so state dependent that I want them to imagine the dream forward from a place of safety and connection, so that they're more likely to imagine home and safety and something that's really constructive. And then find ways to consolidate the new dreams and writing it down and imagining it again before sleeping. And what happens is that these shifts in the dream that you imagine during the day find their way into your body, find their way into your dreams. And then sometimes the dreams are not frightening enough to wake a person up. So they're no longer even technically a nightmare, because that's the clinical definition of a nightmare, is that it wakes you up. And sometimes if they don't wake you up, you don't remember them at all, because we don't tend to remember dreams that we sleep right on through. So then it feels like the dream has disappeared, which is why I think sometimes people stop having nightmares when they do this, because they just don't recall them. And over time, I think their dream lives really shift. So last but not least, some clinical considerations. I think nightmare treatment is best as an adjunctive treatment, ideally within a course of trauma therapy, because I really feel like it's important that the person is resourced and able to do the kinds of activities that would involve entering their dream and imagining it forward and feeling safe enough while they do it. And I would say consider the very two different responses to traumatic injury: the activation or hyperarousal, which is more common, but also the dissociative subtype, because that it's only about 30% of times that it's that immobility response, but it's going to take longer, and it's going to take more patience to work with a person who presents in that way. And I would say that it's really important to know that frequent nightmares are robustly associated with a higher suicide risk. So even though there needs to be a lot of pieces in place to treat nightmares, it's really important to do it. And so ask about nightmares and learn to treat them, even if you don't do any other kind of dream therapy. This is my pitch. This is my mission, to try and really spread this idea. And when nightmares are reduced, what's really cool is that sleep improves, and daytime symptoms of post-traumatic stress injury also dissipate, usually by about half. And the reverse isn't true. When you treat post-traumatic stress, very often the other symptoms will be alleviated, but the nightmares will continue. So, but when you treat nightmares, the post-traumatic stress symptoms will dissipate. So, and sometimes very quickly. Sometimes it can really be such an acceleration of the treatment, because I think just a good night's sleep makes everything so much so different. And so a thing to do in this process is to think about instilling a sense of safety and mastery. And what this tends to do is to take the charge out of the whatever the dream is depicting, often a specific trauma, or maybe even just a sort of a traumatic period, or sometimes the dreams are images or metaphors for it, but they carry the feeling and they carry the autonomic state. And if you can help them feel safe while they're in it, the charge is dissipated and they shift down into the lower half of the diagram that we talked about earlier. And so if you want more information, you can feel free to email me, and I can send you some resources. I have a website, drleslieellis.com, and I've got a blog about nightmares and some courses. And I'm currently doing this article, Solving the Nightmare Mystery, the Autonomic Nervous System as Missing Link in the Etiology and Treatment of Nightmares, which is a huge mouthful. It's being reviewed right now by a journal, so fingers crossed that it will be published. And I'm happy to share it with you once it gets a little bit further along. So if you want that, just ask me. I'm also doing a 2-hour talk, a similar topic, but just longer, on good therapy. So if you're interested in more, you just you can contact me or check out my website, and I will have more about this, because this is very, very much tip of the iceberg, but hopefully enough meaningful information for you to take away with you. And now, after all that spiel, I'm going to stop sharing, and I'm really open to any kinds of questions and discussion that you have.
Thanks so much, Leslie. One of the things that struck me is how similar we have this quest to appeal to trauma therapists to work in areas where trauma shows itself through nightmares and through addiction. And how there's such a strong parallel here. I can see in that shaking your head, that nightmares and Jenlin, this is interesting how Jenlin talked, right, about how there's always this help in the dream. People might not know, but Jenlin wrote a book called Let Your Body Interpret Your Dreams, and he worked a lot with dreams. It was amazing. And in that sense that he also viewed dreams as adaptive, right, as ways of trying to work through this stuff that's going on during the day. So yeah, it just really struck me, the parallels there with how we can't leave out these very powerful experiences that come with trauma just because we haven't paid attention to them, and because they lock the body into this cycle that is a stuck place.
Yeah, I think so. I think that's what happens in recurrent nightmares. It's like, I think it can explain why people have them over and over again, because their nervous system is locked in this state, and it's not finding a way out of it. It's just going back and back around this loop.
Yeah, same thing with addiction.
Yeah.
So questions, comments?
Jane has a comment or a question.
Thank you. And thank you very much. This was really beautiful and helpful and worthwhile. I'm a psychotherapist. I've been in private practice for 30 years, and my area of expertise, I don't like that word very much, is working with trauma survivors and chronic illness and terminal illness. And so I want to just ask you or pose something that kept coming through my mind when you were talking about dreams and nightmares. And I also incorporate polyvagal theory and Deb Dano's work and somatic practices. What I've seen is very relevant to what you were saying with the nightmares, but sometimes nightmares are also part of the healing process, that the nightmare helps my clients realize what they're working through.
Yes.
And what they're kind of mulling over. And it's interesting because the trauma survivor clients, frequently they do change the ending that I got out of that situation, and the door opened and I was able to go through that door. So it's just so interesting to see how dreams can be very a real catalyst to helping clients recognize their strengths and where they're going with their process. The other thing I want to comment on is I think that this really also fits in quite powerfully with people that have chronic and terminal illnesses and physical pain and fevers and discomforts in your body, because frequently the discomfort in your body, it's your body telling you something that then comes out into a nightmare. So I just wondered if you have explored that at all, or if you looked at that, because to me that's really fascinating. The other piece I have, real quick, for a comment from you, is many people have dreams, and I do, and these aren't nightmares per se, but they're intuitive. Like, I will have a dream about what's going to happen the next day, and then it happens. Does that make sense? Mm-hmm. So yeah. It's something with my body.
Yes.
You know, it's like, oh, wow, my crown is going to fall off today. I wake up, I'm totally prepared. I call the dentist. You know, so that kind of thing. It's like the intuitiveness that we have. So when we're really in our gut and more aware. So I'm going to stop talking, and I thank you very much. It's been a real pleasure.
Likewise. Those are all really good points. And you're talking, generally about the helpfulness of nightmares. And I do want to underscore that I think mostly our dreams are trying to help us. And that nightmares help process trauma. And I think they do this whether we're aware of them or not, in fact. And when we are aware of them, when they break through to consciousness, they can be incredible vehicles for transforming trauma. And I especially find some of them, when they're metaphoric, and when someone hasn't got maybe explicit memories of their trauma, or they can't get too close to it, the dreams will bring images that bring those feelings, so you can work with the feelings and transform them. And this can happen within the dreams or afterward with the dreams, or both. And I do find, like, mostly I would say that these are transformative and incredibly healing dreams, that they're not, something that generally to be feared. Nightmares happen, everybody has them. It's only when they become recurrent and, really start to affect somebody's life and functioning, and then they really need our attention. But they're really also just such a great ally in the therapy process. And as for, like, intuitively letting us know when something is up with our bodies, that's happened so many times. There's many examples in the dream communities I'm in of people having say a terminal cancer be diagnosed through a dream, and telling, basically saying the dream saved their lives. And I think that this is, Oliver Sacks has written about this, the famous neuroscientist. He said really that, we have this ability, we have a very incredibly detailed nervous network through our bodies that goes up to our brain. So we do have this information that comes to us. We're just not really that good at listening, not, lost that fine detail. In our dreams, our bodies will, there are going to be subtle early cues of lots of things, like your toothache or your cancer or your pregnancy, or many things that your body knows before you consciously do. But your dreams are kind of the bridge. So you'll dream about things that are happening in your body before you know it. But
I also think that you have to be feeling safe enough to hear what's going on in that dream that's telling you that, and feel able to have that curiosity and that awareness. So I think it comes from a place of being more in the ventral vagal, and if you're really at that hyper arousal, it's much harder to take in what it might be very scary for you, like finding out you have cancer.
Yeah.
So I think as a therapist, that's our role, to help people be able to feel safe enough that they can feel and be able to focus and all those things, to be able to be more curious and not as frightened.
Yeah.
Yeah.
Generally true, although sometimes dreams are insistent even if you're even if you're not open to them. But yeah, it's definitely I think when you have an ear to your dreams, and you encourage your clients to, that there's a whole wealth of information that comes through that that really it is, especially gets and brings up the things that are under the surface, the things that we might repress. They're the kinds of things that you would really, I think, it would behoove you to pay attention to. That I found that it's what research has shown too is that because dreams are often pointing to things that are a bit challenging, or that we repress, or that are kind of just under the surface, that we would have a natural tendency to avoid them because they're kind of tough. It's like that good friend who's going to tell you the truth, even if you kind of like cringe about it. So you have to be a little brave, I think. And but I also find that once you've had an experience of really getting a gift from your dream and something really so valuable, then it really opens the door. And it's really true that the more open you are to your dreams, the more they give you, and the more they participate and help you in countless ways. So thank you for your
Leslie,
question.
there's a question in the chat. How does one convince a traumatized spouse that in fact it is trauma behind the nightmares and it can be addressed?
Well, I don't know. I mean, like I have to say that is, yeah, it really, there's so many ways that it could or couldn't work depending on the nature of the marriage, or so I can't really. I would say, you could refer to some of the things I've said. I think it's hard to convince somebody that doesn't want to be convinced, no matter what, especially around trauma, because it's so sensitive.
Scary.
Yeah.
Scary, yeah.
I wouldn't necessarily push it. I would just encourage, I would be really curious about the dreams. And I think that these dreams, especially nightmares, it's better not to have people we love go it alone with them. So I'd be interested in hearing about them. And, I think just sharing, I say that just, it's a big thing to share a dream and have it heard is therapeutic in and of itself. There's this presence that, you're not alone with it. And I would just be interested in the dreams if I were, I mean, my spouse does have intense dreams. And I have to say that, it's not a good idea to try and step into the therapeutic role. Usually just gets pushed back, but just to be curious and interested and let them ideally arrive at that when they're ready, because before a person's ready, the idea may be absolutely accurate, but it won't be picked up.
Good point. So there's another one there.
Yeah, I see this one about, do you think that other methods that activate parasympathetic nervous system, like slow, deep breathing, might work for nightmares too? Absolutely. I think that, one of the things that can really be helpful is, especially when people wake up from a nightmare and are afraid to go back to sleep, usually their nervous system is very activated. And if they, start with just calming their nervous system, long, slow out breaths, so that they're, more in this parasympathetic state, then you could invite them, even right in the middle of the night, once people learn how to sort of enter and change their dream, to do it right then, because at least they have something to do, and it makes them less afraid to go back to sleep. But yeah, I would recommend that. In fact, I think it would really help. So how do you differentiate intuitive dreams that tell you insightful things about your body from chaotic nightmares? So, dreams are, because they're, our prefrontal cortex is basically sleeping when we're dreaming. Our dreams have this chaotic quality just because they don't have they don't follow the same rules of logic. So part of that is just the nature of dreaming. And I would say that really, when you have a dream that's got something to say about your body and it's important, usually the dream will announce itself, and it will be something that says, pay attention to this. And it may be not always simple to interpret, but it's an example I like to use. I wrote a book for clinicians called A Clinicians Guide to Dream Therapy. And in it, I use this example from Jeremy Taylor, who was a great dream worker. And he had a group where a woman had dreamt about a purse of rotting meat that was so putrid and intense and created such an adverse reaction in her body. And she was with a group who said, you know what, this is something you need to pay attention to. This isn't just like a dream to just let go by. And so she went and had her she had an examination, and the first examination was they didn't find anything, but she was so disturbed by the dream, she went back. And she was about to go on a month-long trip, and she got this diagnosis of an extremely aggressive form of uterine cancer, and she would have been dead before she got back from her trip. So this dream literally saved her life, but it was like it was a dream that really really desperately wanted her attention. And fortunately, she did pay attention to it. And so and not all nightmares are going to be about that, but I guess if you have a dream like that, I suppose it would just be good to check it out and see if it's something, because dreams and the body are so linked that dreams are often diagnosing what's going on in our body before we know it, as we just said a bit earlier. Yeah, I think the dream tells you in a way that you will know. Yeah, I think it's true that, the dreams will be, there'll be a way that they'll be insistent, and they will also repeat. That's the other thing. If a dream's really important, you'll have it again and again, or versions of it again. And so it doesn't just come once, it'll come again. And I really feel like they, they'll get your attention if they can. Have I seen dreams provide ancestral histories? Yes, I think so. Yeah, I would say that that's true. And it's hard to know for sure if that's where they're from, but it seems that way, that people have dreamed of earlier times that feel related to them. I find dreams, and especially nightmares, quite contagious, affect me strongly, more strongly than a more common therapeutic dialogue. Do you have any wise words about dealing with your own reactions to clients' nightmares? Yeah, I believe that's true. I think that anything that has a lot of implicit quality, whether it's dreams or felt senses or embodied trauma that isn't fully integrated or recalled, will come into our bodies. As therapists, it's a way of communicating, I think. And so what I would say is that there is a way, as when I teach people who are traumatized, to be able to keep a part of themselves that's very present and centered and current, and that is not involved in the traumatic aspect of it, that can dip a toe in and come back and stay mostly present to themselves as they visit. And I would say, as the therapist, you could do this too with somebody's dream. Really just be very much present in whatever practice you have to keep you calm and centered. But I do also, when I'm working with dreams or embodied trauma, I do try and, kind of dip a toe in that stream to sample it in my own body. It's just what you want is just a small sample. You don't want to be immersed, and really important as a trauma therapist or working with nightmares to find ways to do that work for you. Mm-hmm. Dreams are more frequent and intense after EMDR. Yeah, I've seen it trigger nightmares. I think it might have to do with the bilateral stimulation, because when we're dreaming, we also do this back and forth eye movement. And so it can kind of stir the same pot. And so I think that's true. And I kept having recurring nightmares of husband leaving, all types of gone missing scenarios, abandonment, betrayal. Even after his passing, I still had the bad dreams. It wasn't until I started addressing core attachment traumas that the dream went away. Yeah, that's really, I don't know if that's a question, or I think that's maybe just a comment of your experience with dreaming and how the dreaming was inviting you to keep visiting these attachment traumas. And it kept, and dreams they can be quite insistent about the kinds of personal journeys or therapeutic work we need to do. And so it feels like your dreams really didn't let go of this until you addressed it, which is, and then they did. And so you can see that as a therapist, when you track people's dreams, that you have this very objective measure of whether a particular theme is still up for somebody or not, because the dreams will keep bringing something until it has been metabolized, and then the dream life will shift. And nightmares in particular, I think when someone's had a recurrent nightmare, when the trauma or adversity issue that's associated with that has been really metabolized, worked through, the dreams themselves will reflect that. Oh yeah, you're welcome. And so sometimes when working with trauma clients, we attempt to introduce resources. There can be an objection. That's not what happened. I don't believe it can be different. How would you work with that? Well, what I always say to that, and that's a really good question, is that first of all, the dreaming is a completely imaginal realm. It's putting you in this experience, and it's something that your body and you are co-creating, and you can make it whatever you want. You're absolutely free to do that. And it's not about what really happened. It's about what needs to happen, what your body is wanting and to move forward. And there's a reason that the dream's bringing you this scenario, and it's not to make you miserable. It's to help to shift this particular this process, and you can take control of it. And what's really beautiful is that our brain doesn't actually distinguish between fantasy and reality. That if we imagine something experientially, richly enough, it feels very real. So you can imagine a solution, something beautiful happening, and it will feel to a good part of you as though that actually did happen. And then what happens when that trauma memory returns is it comes with this new memory, even though it's not true. It doesn't matter. Our memories are so bad anyway that what we actually think is true is probably only half true anyway. So you might as well make it what you'd like it to be. That's my argument. Yeah. And oh yeah, Shauna's just made a comment about my dream work course. Thank you, Shauna. So there we go. I think I've come
Did we
to
get everybody?
I think we've gotten everybody. Is there anybody?
One more there from Layla, maybe?
Oh, did I skip one? Oh, Sarah, sorry. Do you have any experiences or knowledge of how this work could relate to different parasomnias, in particular sleep paralysis? Yeah, sleep paralysis it's an interesting one, and I feel like it needs more study, because there's first of all, when we're in REM sleep, we actually have this chemical that basically, that our brain produces that paralyzes us from the neck down. Every single night, everybody is paralyzed. So sleep paralysis is normal. What happens in cases of sleep paralysis is that a person wakes up before this chemical has stopped. And normally what happens is that you become unparalyzed and then you wake up, but sometimes you'll wake up before that and your body will still be in this dream state. It's kind of a hybrid state, and it can be very frightening. And but I also think that there is a relationship to this immobility response and the sleep paralysis, because some people get stuck in this kind of false awakenings where they wake up and they're still dreaming, and it's very different from the sleep paralysis, which usually will wear off in a minute or two, and it might be alarming until you know what it is. And once you know what it is, it tends to be a little bit helpful anyway to know. You can just wait and you'll wake up and you'll be able to move. But then there's this other state that feels like it's more the dissociative state that's implicated in dreaming. And I don't know where those two cross or how they relate. I just know that that more when people have more early adversity, or their nervous system tends to go into this immobility state when they've experienced trauma, that they're more likely to have these parasomnias. They also, I mean, they can relate to shift work and poor sleep and disrupted sleep cycles. And so there's a lot of other reasons for it, but I just feel like that area is rich for more information, because it seems to me like there's a lot going on there that I don't completely understand. Okay.
People are thanking you, Leslie. It was really great. Wonderful work. Wonderful work that you're doing. Thanks so much.
Thank you. It's a pleasure. As you see, I could talk about this for a
I
very long time.
I know that joyous place of wanting to spread the word, right?
Yeah. There's one about the
there's one more there, Sarah.
Difference between inviting imagination of a new outcome in the nightmare and practicing being present with the scary feelings. I find the presence really helps transform what appears to be scary. For example, when looking at a monster in the eye, I became aware of a soft and tender side. Yeah, you know what? They're not mutually exclusive, because what you can do if you're very open to your dreams is to go and turn toward. I suggest this if you're feeling like this is something you can do, to turn toward the nightmare image. And if you have enough like presence and calm, what tends to happen is that when you see it, it does transform. It's like when you connect with it, it's like it turns into something completely different and softens, as though it's gotten really big and scary to try and get your attention. And once it has your attention, it can relax and it can actually deliver the message. And a lot of it depends on your state. When you're in a state of defense, something will feel like it's attacking you. But when you're in a state of openness, it will come to you with much more softness.
Polyvagal theory in action.
Yes, you can have a copy of my slides. The slide presentation is a work in progress, but I'm happy to share it. Yes.
Okay, we better wrap.
Okay, thank you so much. Thank you, everybody.
Okay, thanks so much for coming, and see everybody at the Ask Me Anything, hopefully with Steve. He's really looking forward to it. Okay, be well, safe.
All right. Bye, everybody.
Goodbye.
Bye.
Bye, everyone.
Thank you.